I am Dr. Ami Chitalia, and I am a breast medical oncologist at MedStar Washington Hospital Center. I see patients with breast cancer, both female as well as male, and I focus on their systemic or full body treatments for their cancer. I first wanted to do medicine at a really young age, and I actually had a grandfather in India who was diagnosed with esophageal cancer many years ago. And that, I think, is really what sparked my interest in oncology to begin with. I then narrowed down to breast cancer because I really enjoyed taking care of women. I enjoyed the continuity that it provides because thankfully many breast cancer patients do well. So it really afforded me the opportunity to sort of do both, where I am treating cancer and I'm specialized, but I'm also able to have a long-term continuous relationship with patients. My philosophy to patient care is really to treat the whole patient, to really meet in the middle where they're coming from, what their values are, what their goals are for their treatments, and really coming up with the right treatment plan for them. I think that patients should choose MedStar Washington Hospital Center for their cancer care because we have such a dedicated multidisciplinary team of providers who truly go above and beyond for the patients and put the patients first and really go the extra mile to ensure that patients are comforted and well taken care of every step of the way. What I most enjoy about my job is really truly the patients that I meet. I get to have conversations with patients from every part of the world, what's going on in their families' lives. I think that that's really the most joyful part of my job. I think with all of the emerging treatments that are out there in the breast cancer landscape, I'm really excited about the future for breast cancer. I think that we are having more and more novel therapies come down the pipeline that both have better outcomes and greater efficacy, but also have much better tolerated side effects. So I think that the future of breast cancer treatment is very promising. I treat a range of breast cancer diagnoses ranging from just sort of what we call atypia or atypical cells in the breast, which we can sort of think of as pre-cancer. I treat pre-cancer of the breast, and then I also treat invasive cancers of the breast. I offer a wide range of treatments depending upon the diagnosis and the stage and subtype of breast cancer that a patient has. That can range from pills such as endocrine therapy, chemotherapy, immunotherapy, as well as targeted therapies. There are many emerging targeted therapies and novel therapies that are coming down the pipeline in breast cancer. We are fortunate that we have these therapies that target the exact type of breast cancer you have. So we look at your breast cancer, we look at the subtype, we look at any molecular markers, gene expression of the cancer, and then we are able to target the tumor accordingly. Our care team is multidisciplinary. We have the physicians, the advanced care practitioners, we have nurse navigators. We also have a patient support services center comprised of case managers, financial navigators, and social workers. We have a nutritionist dedicated to the cancer center. We also have research staff who are involved in the day-to-day matters regarding clinical trials. And we have cancer physiatry and rehabilitation. So we really work in a very multidisciplinary team. During our visits, when we see patients, we see them usually with every treatment and more if needed. And we really focus in on any physical symptoms they're having, treat them the best way that we know. If we feel that the patient would benefit from additional multidisciplinary care, then that's when we sort of incorporate our cancer physiatry experts or our nutritionists or our palliative care experts and really helping them with symptom management. We also have psychology services in-house, so any mental symptoms, anxiety, depression symptoms that a patient is having surrounding their cancer, or their diagnosis, or their treatment, we are able to serve them. We also have a variety of support groups that is run through our breast cancer program that they can be referred to either in person or virtually that they can participate in. And we also have the Smith Center for Healing, we have Hope Connections, so we do have a variety of different ways to meet a patient's needs. I'm the Scientific Director for Clinical Trials at MedStar Washington Hospital Center. We do have about 20 to 25 active therapeutic clinical trials in breast cancer that we can offer our patients, and they range anywhere from national cooperative group studies to industry-sponsored studies, and they range from helping with symptom management. So we have some really cool studies looking at virtual reality and treating cancer symptoms such as pain and insomnia. And then we also have a great number of industry-sponsored clinical trials looking at novel therapeutic agents. I think one of the things I'd want patients to know is that they're really not alone, that any symptoms, anything they're dealing with through their diagnosis and treatment, other patients are probably going through, and I think no question is a bad question to ask. We have so many people on your team to help support and guide you through, whether it be physical symptoms, anxiety, nutrition, pain, anything you need, there is a resource for. And I think it's just about finding the resources and trying what works for you. So just that you're not alone. There are many rewarding cases that I've been privileged to be a part of. I think one of the ones that come to mind is a patient who I've been treating since 2019. And unfortunately, her cancer recurred and she was metastatic and triple negative, which, oftentimes is a cancer that is the most aggressive and has the worst prognosis for breast cancer patients. And I put her on an antibody drug conjugate, which at that time was a bit on the newer side. And she has now been on the same treatment, which normally works for an average about 2 to 2.5 years, for over 4 years, and doing really well. And I just saw her in a follow-up, and she was actually on a trip with her family to Jamaica and had not been able to go on a trip for several years, and was enjoying the sunshine, and she was walking around the beach and just enjoying time with her family. And I think that was really, really nice to hear.